Well, good afternoon, everyone. I have a lot of important information to tell you today, and I am therefore grateful that you have taken the time to join us. You will, I am sure, have seen or heard about the United Kingdom Prime Minister's briefing last night. He painted a bleak picture of the situation. The NHS in the UK is under considerable pressure. Each of the nations of the United Kingdom is now under lockdown. Today, the United Kingdom recorded a record-breaking number of daily COVID cases, 61,000 people. The situation here on the island is evolving quickly. I briefed you on Sunday about some cases that had slipped through our measures and told you what we were doing about it. I'm afraid that I now need to brief you on further concerns we now have in relation to our island's community. It follows 6 positive test results that emerged late yesterday and overnight. We have also had 1 new positive result this afternoon. The positive results are from a mixture of circumstances, although at the moment there is no indication of any link to the 2 cases announced on New Year's Eve. The Council of Ministers held an emergency meeting this morning and agreed a number of measures on which I need to update you. None of this will be easy to hear. There remains a deal of unknowns, and I will be as frank with you as I possibly can be, within, of course, the important constraints of personal confidentiality. I'm joined today by the Minister for Health and Social Care and our Director of Public Health, Dr. Henrietta Ewart. I need to start by telling you that we now have evidence of further spread of infection to others from an index case associated with travel. We now have confirmed cases of COVID-19 beyond the household of the traveller, and these cases are associated with a number of different locations involving potential contact with a large number of people. This gives us a significant risk of reseeding widespread community transmission. We have not yet seen this spread widely into the community, but there is a credible risk that this will happen in the coming days. There is no reason to panic, but there is a need to act decisively. As always, our primary objective is to preserve life. This was, of course, foremost in the minds of ministers when we met this morning and again this afternoon. In addition, we now have a new imperative to protect our vaccination programme. We have to ensure that the plan we have in place to protect our people, starting with our care workers and our most vulnerable, is in no way put at risk. Now, before I tell you the measures that ministers have agreed to put in place to deal with this new situation, I would like to invite the Director of Public Health to brief you on the latest situation from a contact tracing point of view. Henrietta.
Thank you, Chief Minister. And the reason we have particular concerns about the potential for community spread resulting from the cases that were identified last night is that overall the cases have a very large number of potential close contacts, and those contacts are spread over a number of locations. So we have to say at the moment that we haven't been able to assure ourselves that we have closed every single potential transmission chain there, from the people that were contacts, checking them to see whether they are positive, getting them in self-isolation, but then actively seeking cases wider in their contacts where that's indicated. And clearly that is a large job given the number of contacts involved, and it will take time, and there is always the risk that while our contact tracers are doing it, there is the opportunity for further transmission. That's why we'll be putting out some very clear messages about people or groups of people that we would like to get into self-isolation and then call 111 so that we can try and close down these lines of transmission before they do spread further. Thank you.
Thank you very much, Henrietta. Now, it's worth clarifying at this point that we do not yet know whether the cases we are seeing are of the new variant that we have been hearing so much about. We should know more about this in the coming days, but as you would expect, we have based our response on the possibility that it is indeed the new highly transmissible variant, it is right that we plan for the worst case scenario. There are other important pieces of context. The current vacant bed capacity at the hospital is low. This is, of course, not unusual for this time of the year, but it is important we understand this. Also, as in the spring, we cannot depend on our friends in NHS England for any resilience. They have their own challenges. The Council of Ministers has decided to maintain our overall objective of local elimination, and this has shaped our decision-making. Given what we understand about the new variant and the context we find ourselves in, we have therefore had to be bold in our actions. The Council of Ministers has agreed to adopt a circuit break approach. Now, I know that this has had mixed success across in the UK, but our starting point is different. This means we will have to go in hard and fast. This is the approach that worked well for us last spring. The Council of Ministers has today agreed that the following measures will come into effect as soon as possible. All of the following measures must be in place no later than from 1 minute past midnight Wednesday night into Thursday morning. To be clear, that is just over 24 hours from now. But if people can put these measures in place sooner than that, even better. The overarching and most important point is that we will need everyone to stay at home as much as possible. We will require the return to social distancing of 2 metres everywhere outside the home. You will not be able to gather with anyone who is not a member of your household. You will be able to go outside for exercise once a day. We will not limit how long for, but it can only be with people from your immediate household. We would ask you to do your best to avoid any crowded area, and you must wear a face covering. Weddings and collective worship will not be able to take place. Funerals may continue indoors and outdoors only with a maximum of 10 people, with social distancing and the use of face coverings in place. We will be asking everyone who can work from home to do so by Thursday, and ideally, if possible, before. We will require all employers to take this obligation seriously and do everything they can to facilitate. We know that some companies will need to have a skeleton team in place to ensure core services, but this must be kept to an absolute minimum. The construction sector will have to stop work except for emergency work and essential repairs. The manufacturing sector can continue to work if and only if it can do so with social distancing and other measures in place. There will be an orderly closure of schools and nurseries as we re-establish the hub system we had in place before to cater for children of essential workers and any vulnerable children. We expect this to be in place by Thursday and certainly before the end of the week. Head teachers will be in touch in the meantime with immediate effect. School attendance will not be compulsory. All hospitality venues will have to close as soon as possible, but no later than 1 minute past midnight Wednesday night to Thursday morning. This includes all licensed premises, all cafes, restaurants, bars, pubs and clubs. The only exception to this will be for takeaway or delivery food and alcohol only, no eating in. All non-essential shops will have to close from the same time. For most, this will undoubtedly mean an end at the end of business tomorrow. Only food shops and pharmacies are considered essential. We have, however, agreed that for the moment at least, hardware and garden centres can also remain open. On supermarkets and food shopping, please shop responsibly. Although the measures being introduced here today haven't applied to us for the last 6 months, remember the United Kingdom has been in varying degrees of this situation for many, many months, and their supply chains are stable. When you go shopping, please minimise numbers. It should be one person or one person and a child only if you're a single parent. Please do be considerate and leave supplies for others. There is absolutely no need to stock up. Our freight continues to flow, and you will recall that there were no problems with supply in the spring during lockdown. All lifestyle businesses, you will remember that this is broadly hair and beauty businesses, will have to close. Face coverings will be compulsory on all public transport. We have also recommended to taxi operators that they should not pick people up unless they are wearing face coverings. In addition, we strongly advise face coverings to be used by everyone anywhere outside your home when you will be in close proximity with others. All indoor leisure facilities will close. This includes gyms and swimming pools. At this stage, we will not be putting in place an all-island speed limit as we did last year, but we would ask everyone to drive carefully and bear in mind the pressure any incidents may have on the hospital, and we will revisit this if necessary. With immediate effect, we are asking those at significant clinical risk, those who shielded before, to do so again for an initial period of 1 week, and then we will review and be in touch. We will be ramping up our support for vulnerable people who will need assistance with shopping. We have asked all care homes to stop visits with immediate effect. This will be for an initial period of 1 week whilst we evaluate the situation further. We are moving to level 5 of our borders framework. We strongly discourage any travel off island. If people do decide to travel after tonight, we cannot guarantee when they will be able to return. Those who do return from 1 minute past midnight Wednesday night to Thursday morning, again just to be clear, in just over 30 hours' time, will require to undergo a new testing regime. This will be 3 tests, one on day 1, another on day 6 or 7, a third test on day 13. Those returning will have to pay £50 for each test. If people are not prepared to do this, they will have to self-isolate for 21 days, and obviously patient transfers are exempt from this. Returnees will no longer be able to self-isolate with anyone other than those they have travelled with. There will be no financial support for any returnees. There will be some changes to our wider healthcare provisions, as you would expect, and I would like to invite the Health and Social Care Minister to brief you on this. David.
Thank you, Chief Minister. As the Chief Minister has already touched on in his speech, it is important, particularly with the winter pressures, that we preserve bed capacity at Nobles. Therefore, the decision has been made to cancel elective surgery for the next 2 days, at which point we will review where we are in the bed situation and make a further decision at that point in time. Again, as the Chief Minister has already advised in relation to shielding, we will be advising anyone who has previously been in receipt of a shielding letter to shield for the next week, and again we will be reviewing it after 7 days. In relation to patient transfers, these are continuing into the UK, where hospital capacity allows in the UK, but we will be looking through the patient transfer list to ensure that we are sending people appropriately, and those that do not need to travel, we will look to what alternative arrangements can be put in place. In relation to personal protective equipment, our protocols around PPE in the hospital and across our estates are being reactivated, so there will be PPE requirements within the hospital. Equally, we will be advising in care home settings that the PPE requirements that were in place during the pandemic are reintroduced. Care homes and residential homes, as the Chief Minister has touched on as well, our advice to them is to close for visits for the next week, and at that point, after 7 days, again, we will review that advice and issue further advice at that point. In terms of our own visiting policies within DHSC, there will be minimal visiting enacted, where visiting will not take place unless it's in compassionate grounds such as end of life. We need to also protect any what we would refer to as front door entry points into the hospital. So we will be continuing for anyone who does enter to keep contact details. And I know it will probably be a question around the vaccination programme that is now going on, because that sees a large footfall. We will be introducing similar protocols to those that are in place in the UK. So there will be social distancing employed where possible. There will be PPE in full use, and people will be kept in different areas as they go through the vaccination programme. Thank you, Chief Minister.
And thank you very much, David, for that update. Now, we are unlikely to know for the full extent of any community spread for maybe 2 weeks. We are putting these measures in place for an initial period of 21 days. As I've said before, this period starts from 1 minute past midnight Wednesday night to Thursday morning. I hope that it will end on Wednesday, the 27th of January. Within that period, we will, of course, regularly review, and I will keep you updated as often as possible. We will be returning back. We will be turning back on some financial packages. The salary support and MIRA, or Manx Earnings Replacement Allowance, will return for this initial 3-week period. I know that these measures may appear severe to some, but ministers today agreed that we needed to take decisive and bold action without delay, to protect what we have achieved already, and importantly, to protect our vaccination programme. There is no need to panic, but neither can we afford to delay. I know that there will be lots of questions, and we will need to provide more detail. I will do my best to answer questions now, and the team is working away this evening to get additional details available on our website. To remind everyone, that is gov.im/COVID-19. From 8 o'clock tomorrow morning, the COVID community line will be up and running again, and I know that this was a big help last time. The number is 686 262. I'll say that again, 686 262 for any non-medical queries. Now, of course, if you show any symptoms, then you need to stay at home and call 111 immediately. But please do not call 111 with general inquiries. We need to let these people do their job. But the broad parameters are clear. Stay at home if you can. If you can't, then ensure you do everything in your power to be safe. Remember the basics that you did so well in the spring. Wash hands, keep distance, and this time we are going to ask you to use face coverings as much as possible. I will pause now and take questions from the media. And first we have is Dewan Turner from Energy FM. Good afternoon, Dewan. Fastyr mie.
Fastyr mie, Chief Minister. Thank you very much. A lot of information there. It's obviously going to take quite a while to digest it all. Most of it is things that we were used to dealing with last time we had this. Can I just start by asking about yesterday when we were talking with Minister Ashford about the fact that some of these people had tested positive after the 14-day isolation period. As this goes on and develops then, would you be considering, once things do start to move again, that isolation period is now increased, given that you've had more than one case which has shown symptoms after a 14-day period?
Well, June, we've already put in measures in place from the 23rd of December. We brought in new measures that returning residents had to be tested on day 1 and day 13 before they were allowed to exit from quarantine on the 14th day. Now, since that, we have now brought in a further test on day 6 or 7, so that will be 3 consecutive tests before you're allowed to vacate, and that will ensure that we pick up if you've maybe had COVID in the middle of that period of time but have recovered and therefore given a negative test on day 13. So that is designed to ensure that all returning residents now will be, we will reduce the likelihood of this happening again. Now, with COVID, you can never say never, but these 3 tests, our experts tell us, are the best way to ensure that we protect the island going forward. And as I say, we had already put this in place prior to these unfortunate outbreaks, but it happened just before the people that have developed it had arrived back on the island before we implemented this measure. I don't know, David, if you want to add anything to that.
Yes, so the day 1 and day 13 test that was brought in is exactly designed to try and deal with this. As the Chief Minister said, with COVID, you are never going to be able to say never. There is always a residue risk. The residual risk with people past day 13 who might pass a test but then go on to develop COVID-19 is less than 1%. So it is low. We have to remember with these cases, because that testing regime was in place, we don't know if the individuals would have passed a day 13 test or the day 13 test would have picked it up. The likelihood is, on the law of averages, that the day 13 test would have picked it up and would have said that they were positive, because there is only a residual risk of just under 1% that someone would pass that. In terms of bringing in the midpoint testing, which we are doing now, the purpose behind that is to identify people who may be positive and pose a risk to anyone else around them, even within isolation. For instance, you can actually have someone who may pass a day 1 test because they haven't actually fully developed COVID yet. And they might have recovered by the time of the day 13 test, so we would never actually know they've had it. By doing a midpoint test, you potentially pick up those individuals and are able to put mitigation measures in place at that point. So the midpoint testing from an epidemiological point of view is very, very important.
Thank you, June. Your next
Okay.
question.
Thank you very much indeed. Now, obviously, it is going to take a little bit of time for businesses and people to prepare for this, but there will be those who are asking the question as to why it isn't coming in tonight. Maybe you could just clarify the reasoning behind why it has to be Wednesday into Thursday.
Well, I think we have to give businesses time to prepare rather than just saying, as of now, that's it, you're shut down. We are obviously asking if people can do it any earlier, then that would be great. But we need to get our schools prepared. We need to enable businesses to shut down their businesses tomorrow. And we felt that the 24 hours notice was reasonable, but obviously we've made people aware that there is a problem and to take action straight away where possible. I don't know, David, if you want to add anything to that.
Obviously, we are bringing back social distancing, and we would hope that people would respect that immediately, with immediate effects. To be perfectly frank, even in those areas that are essential retail that we do need to remain open, such as food shops, it's completely impractical to be announcing this now and expecting those businesses to have all the measures in place for tomorrow. So we do need to give them a window, because the alternative is they would have to shut tomorrow to get ready, because they haven't got everything in place. So I think it is important we give them a window. Throughout this entire pandemic period, whenever we have done things and done changes, we have tried to give people as much notice as we can. And I think it's perfectly reasonable, given the current circumstances, to give people 24 hours notice of these changes.
Thank you very much, June. We now move on to Alex Bell from BBC Isle of Man. Good afternoon, Alex. Fastyr mie.
Hello there, Fastyr mie. So borders moving back up to level 5 now. We know from the last lockdown this caused some quite major problems for people who are unable to make it back to the island in that short window. What is your advice to people who may struggle to come back home before that cut-off? Can you give them any assurances?
Well, we're not saying no, they can't come back, Alex, but what we are saying is that they cannot quarantine with other people unless they've travelled back with those people, and they must have 3 tests before we will allow them out of isolation. So it's not a case that they can't come back to the island if they're already off island. Now, if people choose to travel, bearing in mind the current situation and throughout the United Kingdom and on the island, then we're not going to stop them from travelling, but they cannot expect us to allow them back if things develop further. And so there's a clear warning to people: if you choose to travel after the end of today, so if you choose to travel tomorrow to the United Kingdom, unless you're patient transfer, then you are going with the full knowledge that we cannot guarantee that you can come back in the immediate future, but we are respecting the fact that people have gone off the island so far, and we haven't been able to give warnings before. In the early days last time, I did give several warnings that people needed to get back. We haven't, because of the speed of this, we haven't been able to do that, and therefore we are allowing people to come back, but they will have to have the 3 tests and the change in isolation rules.
Thank you for the clarification. 3 days ago, you told us repeatedly that the risk was low, when it was clear there was potential community spread since the last week of December. Could these measures have been brought in sooner?
Well, no, the tests, the results, the cases that we've now received, we believe are not connected to the cases that we had on New Year's Eve. This is a different case of someone coming out of quarantine and then spreading the COVID-19 to others. We had done a series of tests on a significant number of people. Several hundred people had returned a negative test regarding the earlier 2 cases. This is a new case. It's very disappointing, but we're faced with a new case, and that's why we've had, because of the severity of the spread and the numbers and the locations, as Dr. Hewitt said earlier, that's why we've had to take action. I think I always said, we weren't out of the woods yet. It would take another week before we were confident that we'd got away with the spread of the New Year's Eve case. However, this is a non-related incident, and this is what's caused us to take these changes. I don't know, David, if you want to expand on or anything I've missed.
No, you've basically covered it off, Chief Minister. It is important to emphasise that the 6 cases we have now identified, at the moment there is nothing to link them with the previous cases. These are completely and utterly separate, but obviously the situation with these cases is very, very different, and that is what has prompted the different approach.
Thank you.
Thank you very much, Alex. Now we move to Sam Turton from Jeff the Mongoose. Good afternoon, Sam. Fastyr mie.
Fastyr mie, Chief Minister. I just wonder if we could ask, there's been a lady in contact with us who's due to go tomorrow on a patient transfer, and obviously there'll also be people concerned about perhaps their elderly parents travelling. I just wondered, Mr. Ashford, could you just outline exactly what will happen for patient transfers over the next 3 weeks?
Yeah, so in terms of patient transfers, they are carrying on as normal. The people who we have always throughout the period tried to limit the number of patient transfers that we do to those who clinically, physically need to be seen. We are going back over that, as I said a few minutes ago, just to make absolutely sure that we are content that those are people that clinically do need to be seen in the UK at this current time, but patient transfers are continuing as normal. If a patient has not been contacted to say otherwise, then their pet appointment is going ahead, and it's believed to be clinically appropriate for their appointment to go ahead.
Thank you. And just secondly, Chief Minister, after the last lockdown, as it were, of schools, there were concerns about remote learning and how that was provided for. Are you confident this will be more successful this time?
Well, I think we've all been on a massive learning curve, Sam. So the first time it was new to our educationalists. Now they've all had time to put in plans that should it happen again, then they can deliver a far smoother service than they had done before. But obviously last time it was something new for us all, and I will be inviting the Minister for Education, Sport and Culture to come online. I hope to be able to give potentially another interview tomorrow, and I will have the Minister for Education, Sport and Culture to give an update on the plans that the Department of Education, Sport and Culture have in place on remote learning for all our students. But a good question, yeah. Thanks very much, Sam. Now we move on to Rob Pritchard from 3FM. Rob, good afternoon, Fastyr mie.
Good afternoon, Chief Minister. My first question, just with regards to the financial support that you say will make a return, the likes of the Mirror and salary support. Obviously, the Isle of Man, just like anywhere else during this pandemic, took a big financial hit during the first wave. How confident are you that the island's finances are going to be able to cope with this over this next at least 3 weeks?
Yeah, well, it's a 3-week period. The Treasury Minister is putting out a full press release on the provisions. It's something that's already up and running, so it's just a case of turning it back on. it will be a considerable amount of money. The previous 4 and a bit years of this administration, we'd worked hard at getting the economy balanced. We'd built up a modest reserve. Now, whilst that reserve the increased reserve surplus, I should say, has gone, and we do find ourselves lighter in the pocket significantly as a result of the cost of COVID, our finances are still in a sound position. The reserves have virtually come back to where they were pre-COVID. So we can't be throwing money away, but I think it's important to support those people that need it. And, I'm confident that our Treasury team have got this in hand.
Thank you. My second question to either Minister Ashford or Dr. Ewart, possibly, just regarding this new variant of COVID-19. We had a question sent through from someone to us earlier today. Has the island got the capacity to work out if the new variant is present on the island?
I'll bring the Director of Public Health in, if I may, in relation to the new variant.
Thank you. Yes, we do not test for the new variant on Ireland. We send it away to the Liverpool Genomic Testing Lab, which, as I said at a previous press conference, is part of the UK Genomic Testing Network. And one of the reasons we do that is to ensure that all the processing is done consistently with the UK national programme, and also that our results feed into that and contribute to the overall understanding of the spread of the new variant. It's also important to understand that whether or not a positive case is related to the new variant is not key for the initial management. It makes no difference to that. It's interesting for the epidemiological surveillance and understanding the spread of the new variant. Over time, we may learn that the new variant has other differences from the epidemiology of all the variants we've currently seen. That is to say, beyond its increased transmissibility, which we now do have very good evidence and increasing evidence for. But that will be something that will emerge over time as we learn more about it.
Thank you.
Thanks very much, Rob. We now move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I?
Unmute yourself.
You haven't unmuted yourself again.
I haven't touched it at this end. I was told I was being unmuted, but obviously that wasn't the case. Can you hear me now?
Yes, yeah.
Okay. Before I ask questions, can you clarify by way about dentists and doctors? I didn't hear anything in there about will they continue as normal, by the way?
Yes, it's business as usual for dentists and doctors. I don't know, Henrietta, any?
Yes, and allied health professionals as well, so physiotherapists, chiropractors, etc.
Okay. My first question, really, I think for David, actually, really, we were talking in our chat the other day about how these cases at the minute seem to have snuck through after the 2-week isolation, and then they were still active. So I think a lot of people are questioning, it seems strange you're not going for 3 weeks to be going from the gold standard maybe to the platinum standard, because until we know about this new variant, which you said yourself, no one is actually quite sure what's going on here. Up to now, 2 weeks was fine, but you're going to keep at 2 weeks.
Well, I think Henrietta's more than capable of answering that one, Paul. So
Yes,
Henrietta.
yes, I think we did go through it on Sunday, but I'll take us back round it. The incubation period is still, as far as we know, 1 to 14 days with a median of 5 days. So 14 days should be an appropriate time after which you can release, certainly return travellers from quarantine. Self-isolation. There are a number of circumstances where that might not work. The first one is, as in the cases that we've seen recently, but this is not implying that this was actually what happened in those cases. This is just a hypothetical that could happen in any case. An individual could develop symptoms actually prior to the completion of the 14 days, but for whatever reason, they don't report them. That may be because they don't notice them, or they don't think they're COVID, or, it's coming up to Christmas or New Year's Eve and they really do want to get out of this self-isolation. So that's one reason. The second reason is that they could be part of that 1%, which we've always known goes on beyond the 14 days, and that's a risk we've always accepted. as we've said before, the problem with working on a percentage risk is that when you only have low numbers of the thing you want to avoid, then you're not going to see it very often if it's only 1%. But when you have a position like we now have across in the UK, where the numbers are so high, even 1% is quite a lot and quite a big risk for us here. So that's another reason. And the third one, and this is important for household isolation and the changes that we've made to that, requiring people to come and isolate away from other household members, is that actually when you come back from across or wherever else you've been, it would be possible that you, if you were tested, you would test negative on day one. You then go on to develop COVID, but you remain asymptomatic. Although you try not to, you do have some interaction with other household members, or maybe somebody who's dropping supplies off for you or whatever inadvertently has a bit of contact with you. You don't know that that's happened, or you don't realise it's happened, and you don't develop symptoms. You actually are one of the 98% who clear by day 10. So by the time you get to day 13, 14, you've cleared, your test would be negative. But the person you infected during that time, either the household member or the person who came to help provide you with supplies, take away your laundry to do or whatever, they actually then go on to present with symptoms subsequently. So there are all those things that are possibilities. Indeed, they've always been possibilities. But as we've said before, when the background risk of any of those things, the actual number of those things happening in terms of the number coming across was very low, the frequency with which we would have seen it here would have been correspondingly low. And in fact, we didn't see it. We effectively got away with it for the 6-7 month period.
Thank you. And back to you, maybe, Chief Minister. I mean, giving people this grace tomorrow for the non-essential outlets, plus, of course, bars and things like that. We've seen that in the UK. We certainly see it when lockdowns they're taking place. People have a sudden feel to go out and enjoy their last moments of freedom, which in itself brings a lot of problems. I mean, first of all, there has been panic buying here in the Isle of Man. You've seen the pictures yourself, no doubt, in all the food outlets. People have gone out there, and certain people anyway have gone quite crazy with their shopping. You must be disappointed with that. Tomorrow is another day that people can go out there and buy all the things they might want, plus go for a hearty drink and be quite legal about it, with presumably no social distancing until midnight. Am I reading that right?
Yeah, that is the situation, Paul. It's a balanced view we have to take. We take advice from our medics, certainly from our Director of Public Health. We have to give a basic amount of notice to let people prepare for this. I think 24 hours is as short a period as we felt we were able to do to give people notice. It's a decision call. If I could point out regarding the increased risk that we had already a week before implemented an additional testing regime for those that were travelling, because we were concerned about the number of, with the increased number of cases in the United Kingdom. It's just most unfortunate that before that was fully implemented, we've had these two different outbreaks. But yeah, we've done our best to give people as much notice as possible, but in as short a confine as possible. I don't know, Henrietta, would you like to comment on Mr. Moulton's view about whether we should have done it straight away?
I think that's right. You're damned if you do and you're damned if you don't on these things, and you have to take a reasonable decision based on balance of risk and the pros and cons.
Okay, thank you very much, Paul. We now move on to Tim Glover from Manx Radio. Good afternoon, Tim. Fastyr mie.
Fastyr mie, obviously you've given out an awful lot of information, and I've got two important questions I want to put, but we are getting a lot of inquiries on specifics. So can I just maybe seek some clarification on those, if you give me that? House moves, churches and sport are the main ones we're being asked about.
Okay, well, sport, unless it's with your same family member, the answer is no. So football, rugby, example, I'm afraid that has to stop. We're saying you cannot meet with anyone outside of your immediate family household. So that puts effectively paid to competition sport. It doesn't stop you from going out walking, carrying out one-off sporting things on your own, but competitions and with other people, it does stop you. And the other point, sorry, Tim,
House moves and churches. Presumably churches you've covered, it's a gathering, so no church meetings.
Yes, no church meetings, sadly no weddings, but funerals will be allowed with a limited number of 10 people. House moves, if it's, unless there's exceptional reasons, then I don't think house moves will be allowed, but I'm happy to clarify that. I don't know if Henrietta has any knowledge on house moves.
I believe they were permitted previously, so some of the detail has to be further worked out, but I think there are ways of mitigating a house move if there is a commitment to do that.
I'll make sure that's on our website as soon as possible. People can look that up.
Yeah, appreciate the clarification. I'll combine the two questions I've got. We've got a lot of people, it would seem now, in isolation, having been at the various venues that have been mentioned, and Nedbank, True Tapas and Wine Bar. If they're in isolation, is it the whole household as well that have to isolate with them? And also, masks is a big change from last time. If we could have a bit of rationale behind why masks are suddenly back on the agenda this time.
Okay, well, I think I'll ask Henrietta as the Director of Public Health on that one to give you an answer, Tim.
Thank you. So firstly, in respect of self-isolation, people will be asked to self-isolate along with their household members if they are identified as a close contact. And this is one of the differences between the cluster that emerged last night and the one that emerged on New Year's Eve, because even though the cases in the New Year's Eve case had been in various hospitality venues, their behaviour whilst there was actually low risk to other people beyond their immediate group. So we didn't define other people who happened to be present in those venues at that time as high risk. They were low risk. The difference with the current cases, and I can't say too much for, obviously one has to preserve confidentiality, but the issue about the nature of what happened in those venues means that the venues that we're identifying as high risk for contacts of other people that were there is different in nature to what we had last week. We don't classify venues as high risk lightly because we appreciate the burden that then creates for people who were there and their household members. But having taken into account all the evidence about the nature of the interactions, and you'll remember we've said before that what matters with COVID is the amount of interaction between people. Overwhelmingly, that is how it is spread. So one has to look at what has been happening in those venues when the cases were present and make a call on the level of risk based on that. And that then feeds into determining who is a high risk or a low risk contact.
And masks?
Masks, well, that's an interesting one because it's one where the evidence has definitely been accruing over the length of the pandemic. And initially, there was a lot of equivocation. You could take up on the basis of the evidence then available either position, either masks are no use at all, or masks potentially reduce the risk of the mask wearer, if in fact infected, transmitting to others. I'm talking about face coverings now rather than medical grade or respirator grade masks, where the evidence was always stronger, much stronger, but where you'll remember there was the issue about preserving the supply for health and care workers who needed the protection the most. There have been ongoing studies throughout the period of the pandemic from various different countries. And again, they don't always show clear benefit or clear absence of benefit. Some of them sit in the middle. Some have design flaws in the way the trials were done that make the results of them not very informative. But taken all together, the weight of evidence now does favour masks as definitely useful in source control. So that's preventing spread from the wearer to other people. And increasingly so, there is evidence that they also protect the wearer from infection from others.
Thank you. Stay safe.
Thank you very much, Tim. And obviously washing your hands, incredibly important as well. That hasn't gone away at number one. Right. Josh, next we have is Josh Stokes from ITV Granada. Good afternoon, Josh. Fast am I.
Good afternoon, Chief Minister. My first question, are you able to go over how these new measures, particularly with gatherings and social distancing, will be policed? And what's your message to people who may not be willing to comply, given the length of time people have been living in this Manx bubble? So, for example, will enforcement take place if people are seen not to be wearing a face mask?
Well, we are asking people to do their best for their island community. The people of the Isle of Man haven't let us down. We went nearly 7 months without a case in the community where we were able to get on with our life, and that was only because the people of the Isle of Man followed the rules, they worked hard, and I would be very disappointed if people didn't keep that spirit up again. We're asking for a 3-week period where we'll give you regular updates on the situation, and hopefully within 3 weeks, by the 27th of January, we will be able to announce that we've come through this. So it's only for a short period of time, and I really hope people can respect the rules and regulations. Now, obviously, if you break the rules on social gatherings, etc., then there are financial penalties and the usual penalties that were there in the first place. But we are asking people to be responsible, think of their neighbour, their friend, their mum, their dad, their elderly relative, their child, and take the advice that we've given and act on it. And I really think in a small community, the people of the Isle of Man will rise to the challenge and deliver and make us all proud.
So do you think the police will play an active role, going to these gatherings and things if needs be? Will you be endorsing that?
Well, I'm not asking people to go around saying, they didn't wear a mask for 5 seconds and therefore they should be fine. The police did a fantastic job the last time and in the ensuing period, and I'm sure they will be even-handed going forward. Obviously, if there are gatherings, which is a blatant break, abuse of the rules and regulations, then of course I would expect that to be dealt with, which they did before, but they were limited in number. Sadly, the same sort of regular names and faces, but it's not Big Brother here. We're doing our best to ensure that we come through this, we get back into the situation we've enjoyed for nearly 7 months now. We're doing this circuit break to enable us to get back on course, and I have every confidence in the people of the island to get us there.
Okay, thank you. My second question, you've always told us the government will take a cautious approach with a strong gold standard self-isolation policy, but do you now accept the government's policy here has failed? These new cases that have caused this circuit break to happen followed the government rules, but the virus has still managed to spread.
Yeah, I mean, you have to put it into context. We have some of the toughest rules in the world, and we apply the gold standard. So the gold standard was 14 days. I think the UK government have got a 10-day rule for people coming into the UK. We went for 14 days. The only successful other jurisdiction was Guernsey, who followed exactly the same rules as ourselves. In fact, Guernsey also implemented the test on day 1 and the test on day 13 at the same time as ourselves to make it even tighter. The measures we put in place worked well for the variant of COVID that was out there for a long time. We saw recently that there was a significant increase in the infection rate in the UK. We took those measures straight away, where we implemented testing on day 1 and day 13, and they will protect, along with the 6-7 day testing, the island going forward. But it's we do have some of the toughest measures going to protect the island. It worked for nearly 7 months, but sadly we now find ourselves in this position. But hopefully in a short period of time we will be back in that position with no cases, and we can get back on with our lives. I don't know, Henrietta, if you want to expand on that?
Yes, I think really, as we said earlier, the 14 days with the 1% risk worked extremely well for us until the rates across became so very, very high, and therefore the 1% obviously became much higher, and therefore, what has happened has happened.
So is there a regret there that there could have been some acting sooner, or do you think you acted soon enough?
Well, I think we're the first to act to implement testing on day 1 and day 13. We brought that in on the 23rd of December, and we are now seeing cases where the testing on day 1 has caught people, and I think today is the first day of day 13 for people on the island. So, yeah, I mean, hindsight is a wonderful thing, but we did bring it in pretty fast when we realised that the increase rate in the UK was getting higher and that we needed to take additional measures. And as I say, the only other successful place in the British Isles, Guernsey, implemented it exactly at the same time as the Isle of Man.
Thank you.
Thank you very much, Josh. And last but not least, we have Simon Richardson from Business 365. Good afternoon, Simon. Fastyr mie.
Good evening, Chief Minister. My first question is on the issue of enforcement. Would you need to seek Tynwald approval for the reinstatement of emergency powers?
Yes, we will be obviously taking this to Tynwald on the 19th of January. The Council of Ministers does have the powers to implement this for a period of up to 14 days before Tynwald agrees to it. I have given a briefing to all Tynwald members this afternoon about the measures we have put in place, and obviously we'll be taking the recommendations and actions that we've taken to Tynwald for their approval, but in the interim period they are legal and can be implemented by the Council of Ministers, but after that period we then need Tynwald approval. So I don't want to say Tynwald will not support it. I hope they will, but that will be for Tynwald to decide whether they wish these regulations to continue.
And returning to a subject touched on by Sam earlier, will those who are sent to the UK on patient transfers be fast-tracked for vaccination before they travel to UK hospitals?
Right, well, that's my understanding, but I think I'd bring in the Health Minister who's been working on this. So if you could just do a swap, please. Whilst we're waiting, obviously, some of the patient transfers, we wouldn't be able to give them the vaccination due to their type of illness. It wouldn't be right to do that. It could cause them more problems. But David, would you like to come in and answer that?
Yes, we are looking at this, Simon. We are looking at what we can do with patient transfers, but of course we've got to take into account the logistics around the vaccine as well. It's a 2-dose vaccine to get the full effect of the vaccine. We know with the Pfizer one in the clinical trials, after 1 dose, it came back as about 52%. So that's obviously better than nothing. For the longer-term patient transfers that we know are going continuously, we've got that 3-week window to be able to get them the 2 doses. But for those that get much shorter notice, it's more of a logistical problem. But we are looking to see what we can do about getting as much protection as we can in place for those patient transfers in terms of vaccination.
Yeah, because presumably this exposes them to exceptionally high risk going into UK hospitals without vaccination.
Well, in terms of the vaccination, like I say, we do have to be careful, though, because there is only so much protection that 1 dose will give. And unless they've got very large, like I say, they're a regular traveller, so we know their timetable of travel, it is unlikely they will have that 3-week window to be able to have both doses. So we do have to temper it around how the vaccine has to be delivered as well and how effective the vaccine is after each of those doses.
Okay, thank you.
Right, well, thank you all very much for those questions. Now, last time you made the right decisions for you, your family, and for your island. I need to ask you to do that again, to protect what we have achieved, and this time to protect our vaccination programme. We've done this before. You know what to do to keep yourself, your family, and your friends and our community safe, and together we can do it again. Stay safe, be responsible, and whenever you can, please stay at home. Thank you very much.